Welcome back. If you have severe low back pain and want long-lasting relief without surgery, we may have the answer for you. Joining us this morning is Dr. Ashley Herfindahl with San Diego Neck and Back Pain Relief Center to tell us about a new technology called spinal decompression. Thanks for being with us.
Well, thanks for seeing me. Thanks for seeing you today, Greg.
And first tell us, what causes low back pain, numbness, or tingling?
Well, what causes lower back pain, we can actually look at as far as these spinal models that we see here. One of them actually could probably be something we call degenerative disc disease, where you actually can see the disc a lot more dehydrated, which actually can cause as far as back pain. That's one type of condition. Another type of condition that we can actually see on this model is we have as far as the actual disc, and this is the nucleus of the disc is actually being herniated outside and actually can cause pressure on that nerve, leading to tingling sensations or numbness. Another type of condition can actually do is as far as the disc, which we call bulging or even slip disc. And all these different kind of conditions can actually cause problems like, for example, sciatic nerve pain, tingling sensations, or numbness. So
it all causes severe low back pain, and this is something these are people who have these sorts of conditions are all candidates for spinal decompression, right?
Well, in essence, yes, but a lot of cases I have to evaluate them to really see whether or not there's a good candidate. That's one thing, is I'm not able to accept every single patient for my type of treatment.
Talk about what spinal decompression is, because a lot of people, may not know exactly what it is. They may have heard of traction or,
sure.
Tell us exactly what it is.
Well, the best way to describe it to you is when we do spinal decompression, we're actually as far as we actually put as far as a harness on a patient. That patient is harnessed. They actually go on the decompression machine, and we actually do a specific angle to actually focus on one particular disc that's actually causing that problem. In that case, when we actually do spinal decompression, we actually pull them in such a way that it doesn't allow their muscles to contract. Now, on the other end, traction, which you mentioned to me, actually it's more non-specific. It's maybe like their neck, their cervical spine, or their lower back, their lumbar spine, and it's actually more of a distribution over all the entire lower back area and not specific. Where decompression comes in, we're actually able to target that specific disc, allowing that disc, as if even herniated or bulging, allow that disc to actually come back, number one. Or also, two, when we actually open up, we allow more nutrients in that disc. Actually, as far as that disc will rehydrate, allowing more as far as oxygen actually penetrate, and results in no sciatic nerve pain, no tingling sensations, no numbness, and of course, as far as no lower back pain or even neck pain.
And the key, no surgery for a lot of people. I mean, that's the big thing with the DRX 9000, the spinal decompression unit, right?
Sure, that's correct. No surgery. There's cases that I'll actually see patients in my office that have actually gone through surgery and it's actually failed.
Right, and you could treat other conditions with the DRX 9000.
Correct. Well, the essence is we're working on that disc and that herniated bulging or degenerative disc. We can even see cases which are really severe patient with spinal stenosis. And what that is, that's actually narrowing in the spinal cord. It's gotten so bad that the spinal cord, you can kind of see on these models, this is the spinal cord here, where it's gotten so narrow that nerve is really frail, just like as you see as far as in this little model here. Mm-hmm. We're actually able to help those patients.
And a lot of people at home may be skeptical that spinal decompression can help them. What's your success rate?
My success rate is over about 85%. So I have great success, but that's, again, going back to it, I have to evaluate really to see whether or not they're a good candidate for me, because I want to help these people. And there's cases that I have to send someone up for surgery. But this is the last step before surgery. They've already gone through physical therapy, chiropractic for that matter. They've had injections in their spine. So all these different kinds of cases, this is the last step. And sometimes we want to find out right away, and the patients, I don't go through all that stuff. I don't want the medications and things like that. I want help right now, and if I want to do as far as work on that structure, which is actually the problem.
A lot of these patients that come to you, they've tried everything, and this is a last resort. And you talked about the evaluation. If people want to be evaluated to see if they're a candidate for spinal decompression, you have a great special right now, $39. Tell us about it.
Sure. What we're doing is we're doing a full evaluation, chiropractic, orthopedic, neurological evaluation, taking x-rays. A lot of cases, if someone has a disc problem, they're going to bring an MRI in. I'll need to look at that. Also let you know the real essence of what I get that's a good success rate is because we do oxygen therapy on this patient. We also do cold laser therapy. We do electrical stim. Also, when they're done, we actually do a really intense as far as rehab program.
So if people want to see if they're a candidate for spinal decompression, or if they have other back or neck problems, call the number you see on your screen, 619-295-3885, the San Diego Neck and Back Pain Relief Center. Dr. Ashley Herfindahl, good to see you again.
Well, thanks so
Great
much.
information.
Thank you.
All right, and of course, for more information, as always, you can go to our website, san diego6.com.